Hi everyone, and welcome to my YouTube channel. I hope you guys are taking care of yourself well and staying fit. In today's video, I'm going to address two very important questions. Number one, that how to diagnose diabetes, and number two, what are the different types of diabetes. Now, in my opinion, diabetes is the mother of many other health problems and diseases, and it must be treated properly from the beginning itself. So, what is diabetes? Diabetes is a chronic metabolic disorder characterized by high blood sugar levels, which, if not treated promptly and properly, can damage the body from head to toe. So, who should be screened for diabetes? So, people aged more than 30 years or even younger if they have some symptoms suggestive of diabetes. Then, people with symptoms of high blood sugar levels like increased thirst, increased urination, increased hunger, and unexplained weight loss. Then people with a strong family history of diabetes, especially type 2 diabetes. Then people with who have sedentary lifestyle and who are overweight and obese, and people with high blood pressure and high cholesterol. Then women with history of polycystic ovarian syndrome or past history of gestational diabetes. So how can we diagnose diabetes? There are four different recommended tests which can be used to diagnose diabetes. Number one is fasting blood sugar level. So fasting blood sugar test is done after more than 8 hours of overnight fasting, and it should be collected in the morning. The second is oral glucose tolerance test. In that, after collecting the sample for fasting blood sugar, the person is given 75 grams of oral glucose drink, and then sample is collected 2 hours after that. The third is HbA1c, which can be done at any time of the day. It does not need fasting. And number four is random blood sugar level, which should be done in people who have symptoms of high blood sugar. So if any one of these four tests is abnormal, then we diagnose that person with diabetes. So if HbA1c is equal to or more than 6.5%, or fasting blood sugar is equal to or more than 126 milligram percent, or 2-hour oral glucose tolerance test value is equal to or more than 200 milligram percent, or random blood sugar equal to or more than 200 milligram percent with symptoms of high sugar. So what are the different types of diabetes? Number one is type 1 diabetes. We also call it as juvenile diabetes because it affects the children and young adolescents aged less than 20 years. It is also known as insulin dependent diabetes because these people, they need insulin to stay alive and to control their sugar levels. This is due to autoimmune destruction of beta cells of pancreas. Now, there is a variety of type 1 diabetes which gets manifested between age 20 to 60 years, and this is known as 1.5 diabetes or LADA, which is latent autoimmune diabetes of adults. In this, initially, these people may be controlled with the oral medications, but eventually, over 3 to 5 years of time, they also need insulin for staying alive and to control their diabetes. The second category is type 2 diabetes. That is by far the commonest type of diabetes, accounting for more than 90% of cases. Now, this results from complex interplay of genetic factors and environmental factors. So, this usually develops in people who have family history of diabetes, and if their lifestyle is not healthy, and if they put on weight over a period of time, and if they don't improve their lifestyle in form of exercise or eating healthy, then there's a high chance that they will develop type 2 diabetes. And this diabetes is actually preventable. And most of these people can be controlled with oral medications, but over the period of time, if they are not getting control with oral medications, they may require injectable therapy. Insulin resistance is the first and the key defect in the development of type 2 diabetes. When it is associated with decline in insulin secretion, it leads to manifestation of type 2 diabetes. The degree of insulin resistance varies from person to person. And in this diagram, you can see the different factors which can lead to insulin resistance, like obesity, inactivity, family history, aging, and some medications. The third type is gestational diabetes, which is diabetes diagnosed during pregnancy. And I have made a full video on that, and you can find the link in the description. The fourth is the uncommon types of diabetes. And in that, we have monogenic diabetes, which includes neonatal diabetes and maturity onset diabetes of the young, which affect the many people of the same family of different generation. Then diabetes due to pancreatic disorders like secondary to pancreatitis and cystic fibrosis. There is drug or chemical induced diabetes, and the most common example is glucocorticoid or steroid induced diabetes. This occurs in people who are being given high doses of steroids or they are given steroids for the long term because of any underlying condition. Now, this diabetes is more common in people who are genetically predisposed for development of diabetes or who are overweight and obese. And this may not be reversible. I hope this information will help you in understanding the diagnosis of diabetes and different types of diabetes so that you can take care of yourself as well as your family members.